Hello, I'm Dr. Linda Jones. Diabetes, medically known as diabetes mellitus, is a metabolic disorder characterized by chronically high levels of glucose, sugar, in the blood. It results from serious impairments in how the body processes glucose. Glucose is one of the body's primary sources of energy and is essential for proper cell function. However, for glucose to enter the cells, the hormone insulin is required. Insulin is secreted by the beta cells of the pancreas. At the core of diabetes lies either an insufficient production of this hormone or the body's inability to use it effectively. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes typically develops during childhood or adolescence and occurs when the immune system mistakenly attacks the insulin-producing cells in the pancreas. In this case, the body cannot produce any insulin at all, and individuals with type 1 diabetes must rely on lifelong insulin therapy. Type 2 diabetes is more common in adults and arises when the body either doesn't produce enough insulin or becomes resistant to it, meaning that the cells do not respond properly to insulin. Type 2 diabetes is strongly linked to genetic predisposition, but environmental factors such as poor diet, obesity, and a sedentary lifestyle play a major role. Diagnosis is usually made using fasting blood glucose tests, oral glucose tolerance tests, and HbA1c, which measures average blood sugar levels over time. A normal fasting blood sugar level is below 100 mg/dL. A level of 126 mg/dL or higher indicates diabetes. An HbA1c value of 6.5% or above is also diagnostic. One of the most notable aspects of diabetes is its silent progression. In the early stages, it may not cause any noticeable symptoms. As the disease advances, symptoms such as dry mouth, frequent urination, excessive thirst, unexplained weight loss, fatigue, and blurred vision may emerge. Over time, high blood sugar can damage blood vessels and nerves, leading to serious complications, such as cardiovascular disease, kidney failure, blindness, nerve damage, and diabetic foot ulcers. These complications significantly reduce quality of life and increase the risk of early mortality. Treatment for diabetes depends on the type of the disease, the patient's age, coexisting conditions, and lifestyle. Type 1 diabetes always requires insulin injections. Type 2 diabetes typically begins with lifestyle changes, healthy eating, regular exercise, and weight management, and may later include oral anti-diabetic medications or insulin therapy. In all forms of diabetes, regular monitoring of blood, glucose levels, consistent medication use, a balanced diet, physical activity, and stress management are crucial. Although diabetes can be life-threatening if left unmanaged, it is a condition that can be controlled. With proper treatment and a conscious lifestyle, individuals with diabetes can lead healthy and fulfilling lives. In addition to medical treatment, patients need ongoing education and awareness. Thanks to modern medical technologies and continuous advancements, diabetes management today is far more effective than in the past.